Good morning, everybody. It's Dr. Galvin with the post-night shift coronavirus update. As I kind of told you guys, I'm going to be working the next several nights in the emergency department. Last night was interesting. Didn't see a single coronavirus case. Woohoo! First time in a while. The other weird thing was like an actual real ER shift. I saw 16 patients in 8 hours. Remember, our shifts are shortened. So that's 2 patients an hour, and that may not sound like a lot, but that's actually a lot for an emergency department. So I think on average, most emergency medicine see between about 1.8 and 2.2 patients an hour, depending on the acuity. So you see sicker patients, and we see pretty sick patients here, you see less an hour. And also realize that sometimes you have like an hour where nobody signs in, and sometimes you have an hour where lots of people sign in. So had a pretty busy night last night. Saw a fair number of sick people, just not sick with COVID or things that I suspected were COVID. Did see a fair amount of heart disease and some substance abuse things and some traumas and other things, kind of typical emergency medicine stuff. But as I've told you before, we've had a big volume drop in terms of other people because people have been afraid to come into the hospital, and it seems like people are starting to come back because we're starting to see kind of typical what we call bread and butter emergency medicine again, and volumes are starting to pick up again. In terms of numbers today, 5.3 million cases worldwide, 392,000 deaths, 2.1 million recoveries in the U.S., 1.66 million cases, 97,000 deaths. And here in North Carolina, 22,000 cases, 737 deaths. Now, interestingly, I don't know if it was yesterday or the day before, North Carolina had its biggest one-day jump in cases. Now, that could be as a result of increased testing, but also, and I think ominously so, it comes about 2 weeks after we opened phase 1. And we would expect if we're going to see increasing cases from opening things up, it's going to lag opening by a couple weeks. And so now we're a couple weeks after phase 1, and we just started phase 2 here locally on Friday, and we suddenly seen a big increase. So if that increase continues, we're going to have to evaluate. I also am a little bit annoyed, and I'm annoyed because it's been reported that the CDC is basically misrepresenting the testing numbers. And what they're doing is that they are combining viral testing, the PCR testing, with antibody testing. And what does that do? Well, when you combine those two things, it muddies the data. So remember, we do viral testing to see who has the virus, okay? So if you come into the emergency department and you've got fever and cough and shortness of breath, I do a viral test, a PCR test, to see if you've got the virus, okay? If you come into my clinic and say, hey, listen, I was sick in January, I'd really like to know whether I had the virus, we order an antibody test. The difference is that I order antibody tests on people that I think maybe have had it. I'm not really worried about it. It's an inexpensive test, and I'm willing to do it sort of willy-nilly. I'm not going to order a viral test in that person because they don't meet the criteria. Well, when you combine those tests, what it makes it look like we have much better testing capacity than we actually do. And that may fit a particular political agenda, but unfortunately, it gives a very inaccurate picture of what's going on. And we're trying to use this data to judge when we can safely reopen the country. It's potentially very dangerous. And not only that, but 11 states are doing it too. Now, many of those states are starting to back off and are starting to report that data separately, but it makes it look like the positive numbers are actually a lot lower than they may actually be. Again, we're doing antibody testing to just sort of see whether people have been exposed or not. And I did make some notes here. I just want to make sure. So antibody tests are useful to see how prevalent the virus has been in the past, okay? Whereas they do not reflect what's currently going on. That's what the viral tests are for. And when you combine the two, And again, we can do a lot more antibody tests typically than we can do the actual viral tests. And if you combine the two and it makes the numbers of positives drop, it looks like the number of cases are dropping when they may not be. They may actually be going up. And if we're basing decisions on that could end up hurting people, right? It could end up killing people. And so, at the very least, they need to give us accurate numbers. Now, the CDC is reversing that policy. Again, I think that there's a political agenda, perhaps, why they would do that. I mean, it's basic science that you would not commingle those numbers. So why they're doing it, I don't know. I don't want to get into politics about it, but they need to provide us with the correct numbers so that we can make the right decisions. I'm tired. I'm going to cut it short, but I do want to talk a little bit about the hydroxychloroquine stuff. The studies that we talked about, the Lancet study, it did look at some of those people did get azithromycin, some did not. It doesn't really say whether they got zinc or not. And we've talked about hydroxychloroquine being an ionophore and probably needs to be combined with zinc. And that's why I'm saying we need good studies to determine whether or not to use it. There's not a conspiracy here, folks. It's not like we don't want to use this medicine if it works. But when you have a medicine that's potentially dangerous, give us a break. We as physicians, we've been given, we made a pledge to do no harm. And so if we don't have good data that it works and we have potential data that it's harmful, please let us gather the data and give us a couple studies that show it's beneficial. Because anecdotal stuff from, these doctors said it works, well, publish your data and let people, let other people review it so that we can all utilize that information to make good decisions, because right now we just don't have it. And if it's a medicine that could potentially harm people, like the Lancet study showed, a lot of potential harm. The people that got those hydroxychloroquine in that Lancet study of nearly 100,000 people, they died more frequently than the people that did not get it. So that's why it's so important to get these studies. And remember, the studies are ongoing, but they're not reported yet. So, we need to have this information. We certainly know it's not a cure, but it's not like we don't want to use this medicine. If we get good data that shows that it can prophylact or it's a useful treatment, we're going to use it. But right now we don't have it. So, let us do due diligence and let's make sure that we're giving people a safe medicine that actually works, not just based on anecdotal evidence, meaning this guy said it worked and this guy said it worked, without actually publishing the data and letting other people review it and trying to reproduce the data. I'm going to get off my soapbox. As usual, wash your hands, look after yourselves, look after your family, look after those around you. If you like this, please subscribe to our YouTube channel, follow us on Facebook, hit the little bell on YouTube so you get updates when we post. I will be posting more wellness content. We've got lots of great feedback about the stuff we posted, and I'm working on a roadmap. I'm going to do a lot more of that, and we may be spacing out some of the content a little bit in terms of the updates going forward, and giving you guys more of a schedule so you know when things are happening. Good night. I will talk to you tomorrow morning after tonight's shift.